agenda, and we're very excited about it. So I'll give you a little bit of an overview. We'll go into our panel discussion, and then a little time for Q&A. You'll have some time for your questions that you're developing and some responses. We'll then be breaking up into our 4 different breakout rooms for some expanded discussion. You'll have an opportunity to interface with our wonderful panelists. And then we'll come back and we'll have some sharing from the breakout rooms, and each group will be able to share, something they've learned or would like to share with the other participants. And then some closing remarks and a little survey for you to give us some feedback. So please remember to write your name in the chat and where you're from and anything else you'd like to let us know about. Thank you so much. As we begin our program, I'd like to familiarize you with our mission to frame our session today. The Division of International Special Education and Services, or DICES as we're known, is a division of the International Council for Exceptional Children. Our mission is to promote international knowledge exchange of special education practice, international research, communication and collaboration, human rights, and advocacy to those who provide services for individuals with disabilities. We sponsor forums for professional development, such as this one today, in addition to our international conferences, roundtables, and other events. And by doing so, we establish networks that foster international association and connections in the global community. We hope that you'll make some of these connections today as a result of your participation in this event. In a few moments, you'll meet our esteemed panelists who will lead the discussion about teaching during a time of crisis and share their insights about challenges, innovations, and resources from their perspectives in different countries.
There we go. Thank you so much. So I wanted to introduce our panel. One of our panel members is Dr. Vicky Spencer, and she is an associate professor and director of the Applied Behavior Analysis and Graduate Program at Shenandoah University in the Department of Psychology. She has over 25 years of experience as a university professor and researcher, and is a past president of DICES. We also have Dr. Deborah Tamakloe, and I apologize if I didn't ask about the pronunciation of your last name, so hopefully I did okay. Is an associate professor of special education at Millersville University in Pennsylvania. Her research focuses on areas of assistive technology, multiculturalism in special education, and pre- and in-service teacher training preparation. Dr. Tamakloe has more than 20 years of teaching experience, including graduate and undergraduate special education courses and K-12 inclusive education in Ghana. We also have Dr. Cina Mosito, and she is an associate professor of inclusive education at Nelson Mandela University in South Africa. Her research interests include inclusive education in teacher education and cognitive development of learners experiencing barriers to learning. And finally, we have Marcheta Gail Hightower, and she is the co-founder and director of the Sunshine Learning Difficulty Center in Dubai. She is a licensed special educator in Dubai, in the UAE, and her motto is, "Let's go to school." We wanted to thank all of our panelists for being here today. As we have moved into our, making it to the first year of this global pandemic, which has really impacted education around the world, and our students emotionally, academically, cognitively, socially, and behaviorally, we really felt that this group could speak to some of the innovations and resources, challenges, changes, and also share different ideas for providing a better environment for students. So I'm going to take off I'm going to stop sharing, and we have our panelists here. So I'm going to start out with the question, what innovations, new resources are happening in your country in relationship to inclusive education? Dr. Mosito, could you start us off, please?
Thank you. A lot is happening in South Africa, but maybe before I go into the innovations, I would like to put that in a context that you all know the history of South Africa, the history of apartheid legacy, which still has its remnants in education to date. And we know, of all the difficulties that came with that, especially when it comes to the resource distribution. And so along that, one of the things that has been the main focus has been, a curriculation of teacher education around inclusive education. And one of the projects that I was directly involved in is called Teaching for All, whereby the purpose was to curriculate inclusive education in teacher education so that all universities that offer initial teacher education speak from the same script, because it was very clear that you all had different understandings of what inclusion was. And so that was a problem, because the students that were graduating, whether it's from Nelson Mandela or UCT or from CPT, are all going to work into the same pool. And it was very important that they speak in the same voice as far as inclusion is concerned. So that is the most recent and most important, a development. And another development has been in line with it, has been on the question of policy development. A lot of policies have been developed since 1994 at the turn of democracy in South Africa. And one of those that I would like to speak to is a policy called Inclusive Education. We call it Education White Paper 6, which really speaks towards, inclusive education, etc. And then there's also been, policies around, how then do we translate all those documents into what happens in schools? And one of the things that has happened is that special schools, some of them have been delegated the role of resource schools. And then some of the mainstream schools have been transformed into what we call full service schools, so that we no longer, as much as possible, learners can come to all the mainstream schools, which are within their community, because they can cater for their needs. And therefore, we sort of cut out on that long waiting list that goes into special schools, which are not adequate in any case. And then within the mainstream schools, there's a new policy that has been developed that is called SIAS. SIAS stands for Screening, Identification, Assessment, and Support. And within that policy, there are lots of tools that teachers can engage with in terms of how they can identify learners who are experiencing barriers to learning, and they work within that with a teacher support team that is based within the school, as well as the district-based team in terms of referrals, etc., where necessary, so that together they can come together as a group in order to come up with appropriate interventions for such learners. And then notably as well in terms of developments is the intersectoral collaboration between the Department of Basic Education, some NGOs, for example, Inclusive Education South Africa, and many others who are doing a wonderful job in terms of collaborating with the Department of Education, collaborating with universities, and a whole lot of people who are interested in basic education and specifically inclusion of learners who are experiencing barriers to learning. And of course, another one is on the area of technology, whereby it's a natural development, let me call it that, with all kinds of developments that are happening with smartphones, etc. Many people are able to access a lot of software that they couldn't, and therefore make learning happen. And some of those software work as assistive devices that are readily available to all. Thank you, Rebekka.
Thank you so much. Dr. Spencer, could you share?
We'll try this unmuted now and see how that goes. I am going to be speaking about Saudi Arabia because I did spend 3 years there. I'm back now currently in the States, but I have an ongoing relationship with them, continuing to look at advancing special education. The biggest change I think that we're seeing is in 2016, the Crown Prince submitted or published Vision 2030. It was all over the media. I'm sure that most of you are at least familiar with that term, Vision 2030. Within that, the main goal was sustainability of economic growth and development, but within that, as a sub part of that, has to be education. So there is a big push on education on one area in higher education, for programs to be developed to do teacher training. That is an area that is really limited in terms of special education and teacher training. Right now, there can be a few classes, certificates that you can take, but not actual degrees. So that's a big push. The thing that we've seen expand the most, though, has been the field of autism. A couple of national programs in the US have now partnered with different universities in Saudi Arabia. So more and more, we're seeing a lot of programs in applied behavior analysis develop. I don't want them to be in place of special ed, but unfortunately, some of the universities are replacing the special ed with just ABA. And that's, I don't want that. I don't think that's what's best. But, you know, the more we're all educated, the more the country's opening up, we're going to be, you know, be seeing a lot of expansion, I think, in general, in all areas of education. Thank you.
Thank you so much. And Ms. Hightower, could you share with us about the UAE?
Sure. Let me see. Let me make sure that am I muted or unmuted? Everyone.
You're good. You're good.
Oh, good. Okay. So the United Arab Emirates, or Dubai, the capital is actually Abu Dhabi, and there's quite a little bit of excitement going on here. Even before the pandemic, we're seeing the emergence of an inclusion implementation. So we're seeing things, they've always had a law in place, Law 29, 2006, which was to support the efforts of people of determination, as they are called here. That would be folks that have any kind of learning disability or any kind of disability at all. And access to education was part of that UN resolution that occurred. So we've seen an emergence of growth here with the term inclusive education. It's still under interpretation by anyone who uses it. So we got to make sure that all of us are kind of doing that. So the KHDA and the Ministry of Education have implemented multiple initiatives aimed at integrating people of determination into mainstream education, social, and work settings. Specifically, the Dubai Disability Strategy 2020 was aimed at making Dubai the most disability friendliest country by 2020. While the Inclusive Education Policy Framework provides information regarding the standards required in the education of people of determination. And that's something here in Dubai that rolled out from what's called the KHDA, the Local Governing Board for Private Schools. The Ministry of Education tends to handle our public schools. Also, the Ministry of Education offers several training programs and facilitates targeting children of determination, their parents, and they had specifically, they're doing like a what we might call a child find, or really a concentration on those beginner learners. And so they targeted kindergarten teachers. They have also set up support centers to follow up and evaluate the progress of people of determination or students of determination before and after integration into schools. The Community Development Authority, or the CDA, which is who license here in Dubai, special educators, social workers, school counselors, and educational psychologists, as well as another division now under special education called a learning support teacher. And your BCBAs or your behavioral therapists are now emerging into, not only do they have to have that qualification, but also they must be licensed to practice here. They're offering tuition assistance of a certain amount for low-income learners with children with disabilities. So there is some movement there to try to make what's called school for all. With the move to online learning, there's programs here that have emerged. One of them is the good old K-12 that emerges from the US. Here it's called iAcademy Middle East, and it allows us at Sunshine to use that strategy for differentiation for students of determination so that they can complete their education at home. Slowly, these online tools and more can facilitate learning and provide the path to some quality education much more easily. So here in Dubai, there's a lot of things, a lot of moving parts, a lot of things going on that also encompass the entire UAE.
Thank you so much. And Dr. Deborah Tamakloe, would you please share with us about Ghana?
Sure. So just to provide a little context, Ghana is a developing country in West Africa with a population of approximately 30 million people, which I will describe as a low resource context in education. So to address the marginalization of children with disabilities and its limiting outcomes, the Ghanaian government committed themselves to inclusive education. And as a way of addressing and responding to the diversity of educational needs by ensuring access to learning for all groups of children within mainstream education. Inclusion in Ghana has been advocated as the most effective means of combating discriminatory attitudes, creating welcoming communities, building an inclusive society, and achieving education for all. Just to provide a little context for that, we do not have so many differences in Ghana, but we have a heavy language difference where we have 43 different ethnic languages. Being an emphatic advocate for educating children with disabilities, I was very fascinated to see how Ghana was rising to the inclusive education challenge in the areas of supporting language and literacy learning for children with disabilities who face barriers to attend school and access books and learning materials. So Ghana's updated special education needs education policy of 2014 has been the driving force behind this transition. There is no doubt that in its early stages of implementation, this SNE policy is working tirelessly to actively include a greater number of children with disabilities in education. Progress has been made in providing low-tech assistive technology, creating environments without physical barriers, and building capacity by incentivizing staff to attain special needs degrees. So right now in all of the teacher training colleges, it has been updated to degree programs, which is a step in the right direction. Nevertheless, these achievements are mainly also taking place in special schools. Strengthening these cannot be undervalued. However, the question still remains whether the early focus on special schools is neglecting the real purpose of inclusive education.
Thank you so much. I heard different pieces around policy and access in all of your responses. And I think that those are both really important points when we think about just the education system and how they're set up in different countries. We wanted to now pivot to really looking at the challenges that your country is facing as it relates to the global crisis. You know, we know that oftentimes around the world that you know, we can have these great systems set up, and then when something happens, they are impacted. Ms. Hightower, would you share with us about some of the challenges that you are seeing in Dubai?
Well, being a frontliner special educator on the ground running every day, dealing with schools and parents and building those educational programs and actually interfacing with other teachers who are also at the school. I think here in Dubai, one of the main things is, and here in, when I say Dubai, I mean the entire UAE, it is accessing the curriculum for the students. That's the number one challenge. When the COVID pandemic began, Dubai began very safely. I still have a lot of confidence in the safety of this country. There's about 10 million residents here, about 9 million, roughly about 9 million of those residents are expats. So, you know, the population here is very diverse. So when the crisis broke out, the main thing was the shutting down, as you know, of all the services, which rendered our kids pretty much, and families pretty much helpless. We quickly remedied that within a few months and got things up and running. And now we have special permission from the Community Development Authority to actually service children in different settings so that hopefully they can continue the support that's at school. The schools are open here in Dubai. Different Emirates have chosen different routes to go. But the main thing that happens is they have a really sophisticated system of tracking the COVID. So they move around in schools in pods. And what happens is sometimes your class is in person and sometimes your class is remote learning. So we have found that with the support of the Community Development Authority, we were able to go ahead and to maintain as many of those services that we could in person with all necessary precautions being taken for the students. So it was a learning curve for teachers. It was a learning curve for the students. Now, also within that, of course, is the very drastic situation where there are some students that again, they are finding it hard to wear the mask at school, or they're finding it hard to stay contained where the school wants them to be. So again, those are all things that are being addressed, and some are being worked with and others are still facing many challenges with accessing the curriculum. So I would say that basically for children with special needs or special education, that is the collaboration of services is the hardest thing that we're facing in this global crisis.
Thank you. Dr. Tamakloe, can you tell me how to
Tamakloe.
Tamakloe. Okay, Tamakloe. Would you tell us about the situation in Ghana, any challenges that you see around the global crisis?
Absolutely. So while COVID-19 has affected nearly all learners globally, school closures have exacerbated already existing inequalities for marginalized learners and come with a host of unintended consequences for vulnerable girls in Ghana. So on April 1st, 2020, the Ghanaian government abruptly closed schools in response to the COVID-19, which has disrupted nearly 9 million learners countrywide. This has led to nutrition and economic consequences because with everyone now at home, families' ability to provide food for their children has even been further reduced. In such poverty, securing food takes precedence over learning. So children are definitely having some kind of learning loss. And also as a result of the quarantines and curfews imposed by the government, it has also led to some kind of learning loss that children are experiencing. Another challenge is limited internet access. So since schools closed in Ghana, the Ministry of Education and other agencies have indicated that learners should undertake online learning or technology-mediated learning on TV, radio, EdTech apps, and mobile phones. But how? We don't know. While such learning may take place in some urban areas, for many marginalized children in remote villages, including our Liberia refugee children in camps, as well as those living with various disabilities, learning during COVID school closures has been a deep challenge. Another challenge is sexual violence and exploitation. So anecdotal evidence suggests that rural girls are likely to be used to cushion families' income, which further exposes girls to sexual exploitation and gender-based violence. This actually places girls at especially high risk of health and reproductive crisis, which includes early marriage, which puts girls at high risk of dropping out when schools reopen. And during the COVID, I went to Ghana for my usual book libraries, book clubs for children. And it is sad to say that I can count on my fingertips the girls in my village who are pregnant. So while it's pouring for some, while it's raining for some children during this crisis situation, it's actually pouring for others.
Thank you. And Dr. Spencer, would you share with us?
Sure. As I was thinking about this question, one of the things I did, because I really want to stress the importance of whatever research is coming out in Saudi Arabia, since I'm not on the ground right now working there with families, but there have been a number of surveys and interviews that have been done with the families during this COVID crisis. I thought it was interesting though, one of the things that came out was they looked at it in a very positive light, was they said for the first time, more and more parents are becoming proactive in the educational process. And historically, within that culture, education is left solely to the schools or to the nannies that come in to work with the kids at home. Well, when everything was shut down, many of the nannies are, hired shadows, as they call their aides, refuse to come into the homes anymore. So then really all the education for many of these students became on the role of the parents. So they said, we're glad that they're involved, but what we have seen, they're clearly not prepared to handle this level of involvement of the educational process. Some of the parents commented on the struggle just to even understand what the students were supposed to be learning. If they did have any technology device, which again, it's only your wealthier families that have access to technology. And even then, it's not any form of assistive technology that some of us might be aware of. So there was a real breakdown on even understanding any type of technology. Then, even though they may have had access to the internet, because many of them do, a lot of teachers, obviously these students are being taught in Arabic speaking schools, but a lot of teachers really always comment on the lack of resources, educational curriculum and content that are done in Arabic. So then you take that away and you have these kids at home. So for the parents to even seek out the kind of curriculum and content they need in the language of Arabic, so they can maybe first teach themselves then work with their kids. That's been a real hardship as well. And then all this is multiplied for families that are the lower income. One of the Dr. Faisal Al-Namari, he is a chief operating officer at the Autism Center of Excellence. Remember, I mentioned how these autism centers, very prominent people from the US have gone and helped people like Dr. Faisal open these centers. He said we should capitalize in these challenging times by keeping the family more involved, because we know that the more the family is involved, the greater the outcomes are. Thank you.
Thank you so much. And Dr. Mosito. Oh, you're still muted.
Sorry, I was muted. Look, the issues that have been highlighted from other countries are similar to what we're experiencing in South Africa, I must say. And one of the daunting, situations here is that children who are most vulnerable as far as COVID is concerned are children with disabilities for several reasons. Number one, most of the special schools in South Africa are concentrated in cities. And so the children who go to special schools, most of them actually, we need them, stay in hostels. And because of lockdown, those hostels were closed. So that means, in essence, those kids didn't have access to education. And I did hear a lot of discussions over the radio, on TV, the questions being asked about parents and other people. What about children in special schools? And and of course, if you look at some of the protocols around COVID, like social distancing, that also poses a major difficulty, especially when it comes to children with disabilities, because some of them actually cannot afford to be social distanced. They need somebody to touch, to hold them and show them around. So that by itself means that the children cannot come to school, because if now the whole idea of not, social distancing is not observed, then it means that they are at risk of COVID as well. So, the question of parents, parental involvement, caregiver involvement has also been quite a troubling one, because the majority of parents, I think it's like that almost everywhere. Maybe let me not generalize, but most of the parents here, the understanding is teachers teach, I'm a parent. And all of a sudden, children are sitting in the house and there's an expectation that they have to be taught. And one of the parents that I spoke to said, I really don't know where to start. What am I expected to do? So I think, that also presents an opportunity of how we rethink education going forward. That's something that I'm going to talk about when you ask the next question. Then another challenge, it's an interesting one. Almost every household in South Africa has a mobile phone. Something which people would think, oh, it means that, oh, people are doing very well. It's not necessarily so. It's because, landline phones are not as reliable. Therefore, everybody has to have a mobile phone. And one would assume that because almost every household has a mobile phone, therefore it's easy for children to stay connected in terms of education. So a mobile phone does not necessarily mean access to other things, because data is very expensive. And most of the schools are in rural areas, or the homes are in rural areas. So even if one has a mobile phone, one does not have very good connectivity or no connectivity at all. For example, some of my students who are in university used to tell me that for me to access anything that you send, whether it's on Blackboard or wherever, I have to go and stand on top of a mountain with a laptop, which is a risk by itself, traveling a remote area to some mountain to access, network. And so that by itself means that a lot of kids are excluded from learning, because learning has to happen through all these kinds of ICT devices. And another difficulty is the fact that we know that teaching online and teaching in the classroom are two different things. And the most accessible app that anyone can use at the moment in South Africa is WhatsApp. I have tried it myself, and I know what I went through, and I'm beginning to appreciate the difficulties that teachers are facing. But along that as well, there are a lot of developments, interventions that organizations like British Council and the Department of Basic Education have come up with a course here called Certificate in Online English Language Teaching, whereby teachers are going to be capacitated in terms of how to teach through WhatsApp as one of those things that almost everybody has access to. So, and then of course, another difficulty is the fact that for many children, if children stay at home, it means that they do not have access to things that they get at school, like, a school feeding program. And that for many is the main source of sustenance. And therefore that's also impacting on their health and general development. And I know some people have tried other ways in terms of how can we reach, kids if, am I still online? Oh, yes. Thanks. It's because I could see that my network was playing along. So, okay, so right. So that's one of the and also the uncertainty of lockdowns, because we were at some stage lockdown level 5, which is the highest, whereby everybody had to stay at home. They reduced that. We went to 4, then 3. Then came December. We were told because of the second wave, we have to go backwards. So everything was closed. Everybody had to stay home. So there's that question of, with the predicted third wave of COVID coming, so what's going to be happening? So everybody is really on tenterhooks in terms of where are we going and how do we plan? Do we plan for a likelihood of another stay away, from schools, etc.? So I would say that the kind of issues that my colleagues have spoken to are also relevant in South Africa. Thank you.
Thank you so much. Wow. So we have gender issues, family involvement, technology, physical space, curriculum and content, vulnerability of students, and then of course the closed schools and social distancing and the impact that it has for our learners. So we've got a lot of things that we're juggling. The next thing we wanted to have this panel think about was the changes needed to provide a better learning environment with all of these factors impacting education. So Dr. Tamakloe, would you please start us out?
Absolutely. So the Ghana education system is based on the ideals of the human capital theory, in that more education and higher education attainment leads to higher economic returns. The focus on the acquisition of the values, attitudes, and skills fundamental to education or inclusive education is therefore often neglected. So while the teachers I spoke to in Ghana hardly ever questioned their given curriculum, they told me that they struggled delivering the assigned information to children with disabilities in the classroom due to large class sizes and lack of appropriate special education training. Of course, there are solutions, and the SNE policy is fighting to implement some worthwhile interventions. However, I can't help thinking that the singular focus on educational attainment is holding the system back from being fully inclusive. So we can count so many examples. Helen Keller was given the space to express her opinions. Temple Grandin, as we all know, had the opportunity to thrive with the appropriate supports. So children with disabilities, specifically intellectual disabilities, thrive in more practical areas of learning. So coming up with new and innovative ways of solving real life problems expressing their talents through arts, technology, and vocally would be, I think, a way to move forward, or will be some changes that would move us forward. Because in this day and age, we rely on exchanging ideas and skills to solve problems and not necessarily recalling complex or irrelevant equations. So it's very important that we change our mindsets about what inclusive education really means for us.
Exactly. Thank you. Dr. Spencer, could you go next, please?
The number one thing that needs to happen in Saudi Arabia is an approval to have online instruction. The Ministry of Education still looks, they frown up on any type of online instruction, even at the higher ed level. When I was there, I did find the policies that did give approval to having a certain amount of online instruction. And then I was informed that that was only for male students. And so if it was a female university or a female school, they weren't willing to try to, you know, use those policies to support what they wanted to do because there's such a fear of being shut down. So it's interesting to see what's going to happen as a result of so many of all the schools being closed, how they're going to have to really rewrite and reframe what can online education look like. So at the beginning of this pandemic, there was next to no training for any of your instructors at any level to do any type of online instruction. So you just think of the repercussions because of that one single law alone. The second thing, and this I really always struggled with when I was there on the ground working with schools, is there's a huge push for inclusion, which, you know, there is globally. We know this has been for a number of years. However, in Saudi, and this may be in other countries as well, but they pay teachers who will teach students with disabilities more than just your general ed teachers. And so therefore, the general ed teacher who actually has the degree, whereas the special ed teacher does not have a degree, general ed teachers are not willing to have students with disabilities in their classroom because they say, why would I let them come in and sit in my classroom when their teacher's making more money than I am and she doesn't even have a college degree? Now, this is not my opinion. There is a lot of research that's coming out about this because what they're seeing in Saudi is that is a major, major barrier to anyone accepting inclusive practices in that country. Last of all, I'll just say, as they move forward, they are looking at expanding the disability areas, where in the US we have 13 disability areas. They have 5, and disabilities like you can be identified with attention deficit or even a behavioral we call it behavioral disorder. If it falls under disorder in that country, then it's not covered by any of their regulations for students with special needs. So it's a very narrow identification. On top of that, the lack of assessments and diagnostics in the Arabic language. Thank you.
Thank you. Dr. Mosito.
Thank you. There are 2, in fact, I have 4, but I would like to speak only about the 2 because in my opinion, they're the major. I think there are 2 things that we need to rethink in South Africa. And one of those is initial teacher education and continuing professional support for teachers along the possibility of some disruptions happening in the future. So the question is, how do we prepare our initial teachers, student teachers, for those possibilities? And I think it's time we rethink content, time we rethink pedagogy, etc., because we can see the challenges that we are facing right now in terms of how COVID and especially the lockdown and staying at home is negating everything that we have been taught as the right way of learning and teaching. So now how do we infuse this into initial teacher education? So in a sense, when I was thinking, I was thinking that probably COVID has given us an opportunity. You know, it's a very painful process, but there are also a lot of opportunities within COVID because it's forcing us to think differently, to say, so how can we be best prepared for this in case it happens again in the future? And also the fact that there is no certainty as to when it's going to go away by itself makes that rethinking a lot more pressing in terms of what we are doing in teacher education as a place where I find myself. So I've really been thinking about this in terms of, so how do I prepare student teachers differently? Speaking to my colleagues at other universities around this. So that's the crucial one, in my opinion. Secondly, I think there's a need to also think about the role of parents and caregivers in education. And how do you bring them in so that in terms of curriculum planning, there's an element whereby we have built-in support, ongoing support for parents, so that parents are capacitated and they feel that they are playing an active role in their children's learning, instead of what's happening at the moment whereby many parents feel very helpless and they're just waiting for schools to reopen. A lot of my friends who have young kids were very frustrated to have their kids at home, you know, which is the opposite of what you'd expect. You would think that parents would be happy to be with their children, but they could not wait to see schools reopen because of the frustration of saying, I really don't know what I'm doing and what to do with these kids. So we really need to think there's an opportunity there in terms of a lot of things, research, maybe, you know, rewriting policy or curriculum, I don't know, but it's something that I think even in this forum, we have to be thinking about how do we now engage parents and make sure that they are ready for these possibilities. Then, and I think another one is given, you know, the fact that education is not the responsibility of education departments alone. So what intersectoral and interdepartmental collaborations seem to be implied by the current, you know, crisis? So who else has to be part of this movement that we call inclusive education, especially when you're talking about education for all learners? So it cannot just be left in the hands of educators and education departments. Everybody has to do their bit in terms of what should be happening. And lastly, we are all aware that some countries are now going through the process of vaccination. But it's very interesting that when you talk about, you know, a frontline workers, in South Africa at least, teachers do not seem to feature. And yet, the same teachers are expected to go into schools and work with learners who come from all over. So I was thinking, I look forward to the time when, you know, who is a frontline, you know, worker? We also rethink it and we normalize that everybody who's working is actually a frontline worker. And therefore states, in terms of putting aside budgets for vaccinations and economic recovery, they really have to be thinking about where teachers are placed within all that, because I feel like they are not really being given the attention that they need. Because at the moment, only doctors, which is good, doctors are doing an excellent job, and everybody in the health sector. But then these teachers, we have to work with the children of the same doctors, also have to be considered so that they get the same vaccination. Thank you.
Yes, thank you. And just to wrap us up, Ms. Hightower, would you share a little bit about the UAE? And then we'll break
Yeah.
in.
Basically, I think you all have touched upon all the big facts that I was going to touch upon. Number one being teacher training. That is something that needs to be improved here. That would be changing for all learners. I think during this pandemic, everyone got a taste of what it's like. Might I equate that to being a special learner? Not being able to access the curriculum because of a health issue. And we know that even outside of the pandemic, we all have learners like that. So welcome to our world, right? So everyone has experienced that and they found it tremendously hard. So what I'm noticing here in Dubai and in the UAE is definitely the teacher training. I like to use the term dysteachia as being kind of a funny term, meaning that some of the teachers have just not, the students have not had enough teacher time in order to make an impact on their success in the classroom or even online. I would also like to talk about defining the roles of providers, as I've heard, meaning that, yes, I'm a special educator, and no, I'm not a behavioral therapist. How about that? And that, yes, you do need special educators to continue to adapt and do your curriculums and your modifications and build your IEPs. And yes, I do need educational psychologists, and no, I'm not one of those either, but we do give assessments. That's another area that's very important. Many learners are coming into me, into the Sunshine Learning Difficulty Center that weren't necessarily eligible for special education services pre-COVID. They might have been in their classrooms and only maybe slightly behind, but now some of the learners have been setting out of school due to dysteachia for about a year now, or just about a year coming March. And basically I'm finding they're coming in, and through this assessment process that we use at our center, we're finding them 2 years behind. They didn't complete the year from last year, so they're even struggling from what they try to remember from the year before. So that all needs to be addressed. And these are students who, like I said, don't necessarily have a eligibility for special ed. And we do have 10 categories of eligibility here. They're all of the ones that are in the US. They just rolled the hearing impaired and the deaf together, and they rolled the sight impaired and the blindness together. So basically we're seeing that. The other thing is that as everything is moving forward, one of the important aspects to focus on is the quality of education delivered online versus in person. And I think we've touched upon that. Online learning on a large scale is quite new, especially in the UAE. So consequently, it can be difficult to deliver this kind of learning in the same manner to your student. But teachers can default to delivering lectures, and students' engagement and motivation is often decreases, as we all know. So I guess we need to move into more of an, as we've mentioned from all of you, more people need to get involved in the education of the student. I know when we were doing our sessions online, we tapped into a local Indian dance instructor who came on and delivered some movements and different things that students could do to try to stimulate them while they sat on the other side of the computer. So we reached to the outside into the community to try to find different folks who could come with the teachers and help and make this more interesting for the learners. Additionally, learning assessments, like I said, need to consider the variety of background that the students come from, as some may not have access even here in Dubai to good internet or need more time to complete the work. So these are all things that you all have touched upon, but I just wanted to focus and say a little bit more about this area specifically. I'm sure there's many more, but right off the top, definitely teacher training, definitely accessing school, definitely the ability of the students to be engaged more in the lessons.
Thank you. You just made my job easier by summarizing things as well. So I just want to thank the panel. I also want to point out, and I'm going to put it in the chat right now, we do have the list of resources from the panel. And it is, each panel member submitted these. They are really wonderful. And then you'll also if you're unable to open this, that's okay. We're going to be sending it out and posting it on our website. So you'll continue to have access. So now we're going to break out into our breakout rooms, and we have facilitators in each one. And so we'll be coming back in about just less than 20 minutes. So each one of our panelists are in one of the rooms. So we'll see you soon. And Dr. Mosito, you're staying in this room with me, so. Mary, do you want to take us through?
Okay, I was muted. We heard some wonderful things from our panelists, and particularly from Dr. Mosito, who is in our room, around the innovations and resources, challenges, changes, and the wonderful hopes for our future. So this is an opportunity for us to provide some further interaction and expand on some of these areas that may be questions for us, or maybe something we want to build on, something we may want to learn more about as we work through this. And we're going to be taking some notes about what some individuals have to share. I just have to say that I was enthralled with what you had to say, Dr. Mosito, and I saw so many similarities to what is happening here in the U.S. in terms of learning and the needs as we move forward around teacher education and the role of parents and their engagement, and some of the challenges that you described, and your hopes for the future in terms of moving forward to really embellish those areas or enhance them to have better outcomes and more positive outcomes as we move forward. So we want to take some comments and some questions even from our breakout participants as we look at these different areas. Was there anything that people heard that they might want to add around innovations and resources?
Or
in
any
terms of your own
category?
experience?
Dr. Mosito, this is Robai. Hi.
Robai.
Hi, bye-bye.
Yes. Hi, how are you? So I know a lot of the challenges that you shared in South Africa, and I am originally from Kenya, so so many parallels with what you are sharing. But what I was just curious about is obviously we have students with the moderate to severe disabilities, and those are very obvious within every country in Africa. You know, they are the more obvious ones, and a lot of inclusive education discussions usually surround those groups of students, right? But yeah, I was wondering about other more invisible disabilities and how that looks in South Africa, you know, like behavioral disorders and actual learning disabilities that are not just visible, like developmental disabilities, the moderate to severe ones. How does that look in South Africa, and what kinds of supports are there, if any, for those types of students?
Well, in terms of support, I'll start from the special school side. We have special schools that cater specifically for learners with learning disabilities, for example. We also have another variety of a school here called School of Skills. School of Skills are for learners who are from the ages of 14 and up, who cannot cope in terms of the scholastic demands of a mainstream school. And the focus for them, it's more about teaching them particular skills, which sort of are also built within the curriculum that everybody's following. But the main focus is for them to come out of school with a skill. So you'll find that most of the learners that you have referred to, those with behavioral problems, and learning disabilities, etc., will be found within those schools of skills, but only from the ages of 14 and 15. The younger ones, because for a child to find himself or herself in a special school is quite a process in South Africa. They have to be tested, then they have to be referred, then the waiting lists are very long from what I've heard, and sometimes they don't really make it up to a special school. So they end up going to the school that is closest to their community, which will be a mainstream school. And then this is where the policy that I spoke about earlier, SEAS, kicks in, and what you call a school-based support team with the help of the district officials, etc. So together they will work together to develop an intervention program for learners who are experiencing difficulties. I know that they go as far as where necessary, developing an individualized educational plan. And of course, as much as possible, they'll go for a group educational plan because it's more affordable to do that. In terms of the resource, strains, in terms of the necessary therapies who could be helping such learners. So we have most of those learners in mainstream schools, and very few of them go on to go to special schools or school of skills because there are not many. So, and this is where the struggle is, because teachers, when it goes back to teacher education, it goes back to pre-1994. Before now, we had one education department, whereby there was a clear separation, whereby teachers, it's either one would see himself as an ordinary teacher, or one would be called a special education teacher or a remedial teacher. Some teachers seem to be carrying that internalized inferiority, if I could call it that I'm not good enough to do this because I was not trained to do it. And that is why one of the things that we are doing in the teacher education space is to now mainstream inclusive education within teacher education with the new curriculum that we have developed, because we want a new cohort of teachers who are graduating to say that I am capable of doing it. They have the kind of attitudes that we need for teachers to deal with all learners and not separate them in their mind or to feel that they belong to another space. Because the reality is we do not have enough schools, special schools. So every teacher has to be prepared and willing to help and teach learners, no matter what barrier they present with.
Well, thank you so much. So how is the, and I don't mean to take everybody's time, but I'll just ask a follow-up. So pretty much what you're doing at the teacher prep level is capacity building for,
yes.
How is that working as far as resources for you as a teacher preparation person?
Look, we work a lot with teachers in special schools. Yeah. For example, at one university where I worked, so we at third year level, because the teacher education degree is 4 years, it's a 4-year degree. So at third year, we made sure that our students go to, as part of their teaching practicum, they also spend time in special schools, different special schools, to get a sense of what happens there. So, and because we are not ourselves as academics trained in some of those therapies, so we rely a lot on people with that kind of specialist knowledge. They will come and give talks in professional studies, classes. Our students are exposed to this, so they get a sense of what's happening in special schools. And I must say, many have see that as a career change, because it gets them to think of another possibility they could take as teachers. Okay. Because we train them as mainstream teachers with a clear, explanation that you are going to be working with all learners. But then they also see special school as a possibility that they can go into. And I know that quite a number of my ex-students have actually gone into the special school space. The problem, though, in South Africa is we do not have particular courses at the moment. I stand to be corrected, for special educators. I know I went through that much early on, but it was phased out because it was very expensive at UCT. Okay. And then, and I'm aware that many other universities have also taken it off. So it's only now that, people realize that inclusive education does not mean doing away with some special education, attributes where necessary. So I think it's been taken up again, but rather slowly. So I don't know if I've answered your question because I went into quite a number of things. Please tell me if I have.
No, you have actually, and a lot of what you're sharing just highlights the challenges in building capacity, which is across a lot of nations in Africa, including Kenya. Yeah.
Yes, that is true. Dr. Jez, you're muted.
Just accidentally unmuted, Mary. I saw that Robert has his hand up. So
Robert.
Yes, I think he is.
I'm glad that I wasn't sure exactly how to raise my hand in here after all this year online. First of all, I just want to say thank you for putting on this this presentation. It's really been wonderful to listen to what's going on around the world and for all the preparation. I can't thank you enough for that. I did have, this is kind of a hopeful thing. I'm thinking, hopefully, hope for the future, maybe in this column. I'm wondering, really to any of the panelists, to anybody in our group, to what extent that this COVID crisis is an inflection point for inclusive change. That here in Canada, we've been allowed to do things that we probably would have taken years to get permission to do. But people are more open to these kind of ideas. And I'm just wondering if other people have had some similar experiences, and maybe how can we harness this change to continue to progress inclusive education across the world. Thanks.
Is that question to me or to everyone?
Really, anyone, but great. Lovely for you to start.
Look, I agree with you there, Robert. I think it's something that I raised earlier on, that as much as we always look at COVID-19 in terms of the disadvantages that it brings, but we also have to look at the possibilities and opportunities within that space of COVID-19, that we are being forced to think of doing things differently, which is not bad, really. Take something like teaching through WhatsApp, really. Who would have thought that it would be the most preferred way of teaching? And we are doing it. I'm taking a course now, a certificate course in how to teach through WhatsApp, because I'm going to teach my student teachers how to do it. I'm going to train some teachers how to do it. And we know how in the past, when social media came into being, people used to frown upon it. We saw social media as something for young people. But all of a sudden, everybody's on social media because we realize its value, beyond the negatives that could happen on social media. There are also lots of possibilities. Facebook, I don't know how many webinars I've been on Facebook alone. And I look forward to every one of those webinars. And I know when this one was being advertised, a lot of people in my circles were asking me to be on Facebook. I said, I don't know. I should have asked, maybe it is. So there are lots of possibilities, wonderful possibilities that, COVID has brought us, because we have been allowed to bend the rules. And I'm hoping that we'll take forward some of those lessons.
I just added in there also, in Mexico, they are now broadcasting school on TV, because most people have TVs, but not everybody has a phone. And so that's another example of an innovative way of bending the rules. I like the bending the rules.
I forgot to mention, we have that in South Africa as well. On national TV, they also have lessons, especially for grade 12 students. Last year, they were speeding up things there. I'm not sure if they have started now in the new year, because our new year has just begun.
So actually, another thing about the positives I could add in working with immigrant families, that's kind of the kind of work that I do. And just speaking anecdotally to some parents, immigrant parents, and we always, talking about the challenges of parental involvement. And there's that one missing piece that actually the panelists alluded on, in the differences in educational systems. And, beyond culture and language, that really plays a role in the involvement of families, immigrant families. And one positive thing that I'm hearing, and I'm actually trying to do some survey general, just based on a few parents. I was like, hey, this is something here. And what I'm hearing recurring is parents now being able to help their children better because they do understand what is going on in the schools with their students, because they're able to sit there with the computer and listen to the things the teachers are saying and how they're teaching them, so they can reinforce that at home. And for these parents, they think that's a positive. They understand more what is going in the school. And obviously, that's a big piece in parental involvement and participation when they do understand what actually is going on in the schools, which is not always the case with the immigrant families. So.
And I think to add to that, Robai, there's renewed respect for teachers because of COVID. I've had a lot of parents who say, I didn't know that you were working so hard. Thank you so much. Because, you know, for a long time, there was a very negative attitude towards the profession of teaching. You know, I don't know if it's like that in every country, whereby the moment you mention I'm a teacher, people don't think you really matter that much. But right now, people realize how important teachers are. And I think that's one of the positives that COVID has brought into our lives, that teachers' position has been elevated.
Now, if they can back that up with some money.
Oh, yeah. Say that again.
We have another question too.
I just wanted to, hi, my name is Sarah.
Hi, Sarah.
And I'm in the United States. We are working very hard on what we call family engagement, which is also turning that about respecting teachers. It's turning it to the other side for teachers also respecting families and understanding how to develop very authentic relationships with them so that they can collaborate together on important decisions in order for the kids to have better outcomes. And we find that there's a lot of work that needs to be done in first having teachers understand that this is their responsibility to reach out to the families and be able to meet them where they are at without judgment or conditions in order to partner positively. I'm wondering if this is going on in other places.
Well, Ed, if I were to talk about South Africa, you know, parent involvement and engagement is a big challenge here for many reasons. Many parents are working and they're working long hours. And that's one problem. Number two, many children do not go to schools in their communities. One of the things that I had wanted to highlight, but I forgot, is the fact that, you know, South Africa is a highly diverse country. So within the schooling space itself, geographical positioning of schools, we have what we call township schools versus suburban schools. And then, so township schools, predominantly, people who go to them are Black children, colored children, and Indian children. I know I always get asked, what is the difference between colored and Black? That's how in South Africa, there are colored people, there are Black people. So, and then, then there are suburban schools. So suburban schools are mostly multiracial schools, which are in suburbs. And what's interesting is that in those suburban schools are not necessarily children from the suburbs themselves, because their parents have pushed them into private schools. Because especially when the Black children now went into the suburban schools, there was, I don't know, some resistance to that. So they have now pushed their kids into private schools, which could also be within the community or elsewhere, but they are not public schools. So now that makes it very difficult now for parents to really be involved, because if you take a parent whose child comes from a township and goes to a suburban school, which is, say, about 50 kilometers away from home, and so we have to factor in issues of travel, how to out travel to that school to speak to the parent, to the teachers, And also there's a question of language. So what language is being used in parent-teacher meetings? So if the parent is Xhosa speaking, and then the teachers speak English, so, those also bring in power dimensions, whereby parents feel that they do not have the language and maybe the power to engage with teachers the way in which they expected. And I'm glad that you are raising the fact that the point that it's for schools to reach out to parents with respect. Because in one research that Dr. Jez and I was doing, a community engagement, teachers were complaining that parents are not interested. I don't think they saw it as their role to reach out and make parents feel welcome. In fact, they called us in to help them to, what was the purpose of that project, Rebekka? To increase parental involvement in the school.
Family engagement, yes.
Yes. So and they seem to think that it's going to happen just like that. They didn't seem to understand the power dynamics that are involved in that kind of relationship, especially when you bring in those diversity issues that I've just highlighted. The geographical positioning of the school, language, race, class, and many other issues. Thank you.
Yeah, we certainly deal with those same things here. And that is always on the forefront, that we have to recognize the language differences and be able to deliver the information in the language that the family is comfortable in receiving it. We have to look at, histories. People come from different backgrounds and experience, and they may or may not understand the system itself or how they can engage. So it's up to the schools to honor and welcome them.
No, thank you very much for that. It's something that I think I should remember when I have discussions with teachers.
And this another layer there, and I know it's in a lot of countries that are not US, that boarding schools, where kids go away. They go there away from the parents for longer periods of times. And during those times, really, the teachers are the ones that are responsible for the learning of the students, and parents are not directly connected. They will reach out to the parents if there's an issue. And usually, so and when you think about such families, and then they have to move to to the United States or other places, they're still there, thinking, hey, my role here is if my child starts misbehaving, then I will be called in. Otherwise, So
I have to tell you all, I have the worst job of closing all the rooms and bringing us back. Is there someone who would be willing to just share out like about a 2-minute share, or actually now about a 1-minute share about what we talked about? Ben, careful, I'm gonna call you.
Maybe Robai should, because she's been asking lots of questions.
Oh no!
Oh, perfect,
okay.
Robai. So, all right, we're gonna close this out. Oh, we've got 120 seconds.
Would I have this slide to refer to?
Yes, you will. Yes.
Okay, awesome.
Okay. See, that's the problem with having me around and knowing me, is that I'll put you into the breakout rooms. Welcome back. I don't know if you had as wonderful of a conversation as we had in our group. We've got one more group that's going to be coming in. They're taking every second that we gave them for coming back into the room. But if you have somebody that can summarize what you talked about in your group in about a minute, and we're also going to be sharing this slide deck with you all so that you will have access to this, in addition to the resource that I've already put in the chat box, but that's also on the slide deck. So they've got about a minute more to come out. So if you can maybe choose someone in your group to share out, and so we can hear about the wonderful discussions that were happening, that would be fantastic. Yeah, time goes by so quickly.
Absolutely, Rebekka. If you want us to get started, I see Nicole still typing furtively on our discussion with Marcheta and our group in Breakout Room 3. And the discussions were really rich. And one of the things I think that we found was so amazing are the professional attitudes of teachers and the change in the teaching profession that we see moving forward in adapting and being flexible through crisis. We know it hasn't always been easy, and we had we talked about the challenges with our students, with technology, with getting parents up to speed, getting our students engaged online, and now also in the hybrid classrooms where they're in person and in at home or in other locations. And those challenges are being met by incredibly phenomenal teachers. And that's really what a lot of ours came down to, was teaching, and that discussion of teaching and how that's changing, and how we've changed the IEP process in the United States, how in Dubai, parents are enrolling students. They're recognizing that they can have access to quality education online. And so they're coming to the Sunshine Center. And again, with in the US, the parents are actually attending the IEP meetings when before they may not have been able to. And I think the most exciting thing was the hope for the future. And again, those changes in the way that we reach and teach all learners in our classrooms. And that excitement in teachers as professionals, and lifting our profession to even greater places.
Wonderful. Thank you so much. Would Dr. Mosito's group like to share? I think it's Rebekka's going to summarize.
Okay. So in our group, it was exciting. Different kinds of, I guess we did not speak specifically on the innovations and resources, but started out with the challenges, ongoing challenges. And what we actually discussed a lot was to do with capacity building, especially when the in-service teachers of professionals don't feel competent enough to be able to support students in an inclusive setting. But laying that burden on the teacher prep programs and the pre-service personnel, training them to feel empowered to embrace inclusive education. So that was one of the major challenges that we focused on. But the changes, as far as the changes and hope for the future, mainly focused around technology, especially in the COVID era, and how we can view technology in a more positive way as a tool to increase inclusive education. Things like harnessing the power of technological tools like WhatsApp, and to build capacity in reaching out to parents and exchanging strategies for providing support for all students. And also what we talked about specifically for the positive sides of COVID-19 is how it has increased respect both for families and teachers. So on the side of the families, there's more respect on the work that teachers do and more appreciation, but also on the teacher side, there's more respect on families and more an understanding of the challenges that families face and how to approach them to increase a more collaborative approach in supporting the children.
Fantastic. Yeah, I was very excited about our family engagement discussion. All right, so group 2, which was Dr. Tamakloe's group, do you have a share out?
Yeah, it was, it was interesting because a lot of that discussion, we talked about things that were going on in China. There's some new concepts that they look at the resource room as being sort of a new concept. They're moving towards that. We also talked about how most of the countries we've been doing work with or in or sharing, they have some type of policy on inclusion and inclusion education, but the struggle is how do we implement it in that? And so there was some sharing on some of the things that were going there. Again, I think that that would be no surprise is that we also talked about the limited resources and the challenges that were presented to everywhere. I mean, we talked about the UAE, we talked about the United States, and we talked about China. We talked about, I think it was Nicaragua, and some of the limited resources that are there and the challenges those present, also having access to the curriculum. We talked about a little bit about using new materials, but the lack of knowledge and technology. And one of the things we talked about was no matter where we go, having technology is great as long as you can access it. And a lot of times we don't have the ability to access. So even if students have laptops or they have tablets and that, they really don't have there are challenges to being able to access that. So how do students keep up with the inability to access the curriculum? One of the things that was talked about for one of our newer teachers, that she's doing a split classroom. So they actually have students in class, but they also have students doing virtual. And they have special needs students that are with them, but they also have special needs students online. And so trying to be able to sit there and figure out how you do that and the challenges it presents. And then just the whole, the need to make sure that, you know, with a lot of our students, they need to, you know, a lot of our schools are also feeding students. And so, you know, we talked about how schools are trying to provide meals for students so that they can participate in the activities in that. And then just to stress on the teachers. A lot of our teachers were never taught how to teach online. And so the ability for them to be able to adapt to learning how to teach online, and that, unlike some of our newer, younger teachers who grew up with technology, some of us who are a little bit more mature, I guess I would say, don't always have those same skill sets and that. And so the challenges that presents, and just the whole stress on teachers and staff and administrators, and how we try to meet all these needs that no one really ever anticipated.
All right, thank you so much. And Dr. Spencer's group 4, would you like to share out?
Okay, so we talked about a lot of the same things that are already mentioned. It was a great discussion, and it was lovely to meet other people who are facing some of the same challenges that we're facing. Just that, like, camaraderie of, you know, we're doing this and you're doing this is really helpful and encouraging. We did talk about many of the same challenges, and you know, the need for teacher education, but also for parent education, and how to approach some of that. And we felt like, you know, because people are having to do so much more distance teaching, that teachers and parents are going to be more familiar, comfortable with technology. So that gives us opportunities that we, that maybe people weren't comfortable with before, but that we could use now to do some of that teaching and training that we want to provide. So yeah, I don't want to repeat what everyone already said, but.
Well, thank you so much. I'm going to actually go to the last slide, and then I'll come back to the slide before. I just want to say I feel so privileged to be with such wonderful educators from around the world today. We have created a feedback survey, so you can either hold your phone up and get the QR code right now, or Clara, can you put the tiny URL into the chat box?
Yes.
And this will just allow us to make sure that we're planning things that are useful for everyone, and also get some better ideas on how to reach out to people a little bit more. So I will hand it back to Mary now to close us out.
I want to thank everyone for their very active participation. It was really awesome to have our extraordinary panelists share their knowledge and insights, and then to have an opportunity for some interaction in the breakout groups, and really looking forward to getting all that feedback together. But we know we had many similar themes around teacher training and education, putting inclusive practices into place, certainly family involvement and family engagement, And then all the opportunities that are before us in terms of hopes for the future that this pandemic has actually created. And listening to everybody talk about turning those opportunities into positives and positive outcomes for students and for families and further collaboration. So I'm really excited about our next steps and other opportunities we have for interaction. And we have a few of these on the slide here. If you're not already a member of DICES, and I know most of you are, please join DICES. We'd love to have you continue with us in many different ways. You have the website on the slide there, and certainly our social media platforms. If you are going to be at CEC Live the week of March 8th, we have 2 special events we'd like to invite you to. Our membership and business meeting on Friday, the 12th, followed by our reception, our social, and our awards presentation that same evening. It'll really be fun. But most of all, we have a wonderful international conference coming up in Dubai. We're partnering with Marcheta Hightower, who you've met today from Learning Difficulties Center there, June of 2022. Stay tuned, visit our website. You'll see lovely pictures and more information about that, and another call for proposals coming soon. We'll have 2 more virtual events. As I mentioned, this is a series of 3 coming up in the summer, June 26th, and then October 23rd in the fall. So please, again, watch our website for further details and registration and topics of interest to you. But we'd love to have you join us again. You've just been wonderful, active participants, and we've really enjoyed the session and being with you this afternoon today. So thank you all, and we look forward to seeing you again in some way in the future with DICES.
Thank you.
Thank you.
Thank you.